Hello, everyone. Keith Tebow here, FRCMedia. I'm glad you're able to join us this afternoon. We're doing something a little experimental. All of us are working from home, or many of us are working from home because of COVID-19. We've set up a mobile studio here. We hope to do some more live feeds here on Facebook Live as well as on Channel 95. Our interview today will be on Channel 95 a little bit later on this afternoon or this evening. And we're going to be talking to people from time to time on how they're dealing with the crisis and getting some information out to you, the viewers of FRCMedia. So what I'd like to do right now is welcome our first guest today. We are pleased to be joined by State Representative Carole Fiola. Representative, thank you for joining us.
Thanks for inviting me, Keith, to your debut remote broadcast.
Yeah, everything appears to be working well right now. So let me just ask you, first of all, Representative, how are you doing? How's your family doing? And how are you able to serve the constituents of Fall River from a remote location?
Thanks, Keith. Well, welcome, everyone. Like everyone, we're all, this whole crisis is rolling out, and we're responding as we go along and anticipating ahead what needs to be done. But like every family, I'm affected. Only a very tiny group are allowed at any time at the State House. So we are all working remotely. So my staff and I are working from our homes. We have tried to be as active as possible on social media and emails with updates that we receive daily so that we can share the most current information that people would want to know. So we are working, we are fielding calls and emails and texts and messages all day. We're pretty much open 24/7, and everyone and anyone who needs to reach us has been getting through. So that's something we feel very strongly. That is our obligation as representatives to do that. And we've been helping a lot of people. There's a lot of anxiety out there. Every family, it's affecting in different ways. Mine is as well. I have a daughter who's a nurse anesthetist in the ORs of Lincoln, Nebraska, who's moving back here next week, if it all can work, to begin a new job in Rhode Island hospitals. The crisis we're a little bit ahead of it than Lincoln. So, there's a little anxiety there, and she's also planning a wedding. So those dates are all fluid right now. So, every family's got these things. The most important thing I can say, though, is this crisis and this disease is behavioral. We can control it to some degree with what we do every day. And that's why working remotely, social distancing, staying home if away from errands or anything, if you're not feeling well, the simple washing of the hands, those are the things that will keep us, with that flattening the curve. So that's pretty much a little update on all of us. My husband, Ken, his office, he's a lender, actually. They do loans, and they have a loan program right now, $500,000 for small business in Fall River. And, he's going to work every day. His office only has 3 people, and they're social distancing. So I think we're all responding the way we need to under these circumstances.
I want to make it known to the viewers right now on Facebook Live that we're able to get some questions from you for the state representative. Just add them in the comment section of this video, and we'll see if we can pass them along to the state representative as we go along. So, Representative Fiola, what are some of the questions that people are asking you right now? There's a lot of people who are hurting. People are being laid off. There's a lot of uncertainty out there. What are some people asking you when they're calling your office?
So it's kind of evolved and changed, Keith, over the course of this virus. Right now, the primary concern for people is accessing their unemployment insurance benefits. And we're trying to, matter of fact, we have probably 10 cases right now that we are trying to facilitate some issues that people have had with them, and we'll get them resolved, and they will get the answers they need, and they'll get the benefits that they are entitled to. And we're trying to respond very quickly, but those evolve as the main issue right now. I'm going to direct everyone right now. If you have not filed your unemployment claim and you've been laid off, please do so as soon as possible. The sooner you do it, the sooner you'll be processed, and those benefits will be, prepared to be sent your way. I'm going to direct you to Well, all of this information is on my website, carolefiola.com, but I'm going to also direct you to mass.gov. There's a COVID link at the top of that page, and everything you need to know, every update, every order, everything we've done, everything the governor has done is on that page. There's an unemployment link on the right-hand side, and that will take you to a tutorial. It explains things that are very important, like if you've already had a claim before and you have a username and password, what you should do. If it's a brand new claim, it's very clear. But just like anything, if you enter a little bit of wrong information, really stops it. It really creates a problem. So, and that's where we've come in. So I'm on Facebook, Carole Fiola. I have a page, Elect Carole Fiola. You just Google me and you'll find me. Our numbers are there. We've been posting all day, every day. And again, today it's 2:00. We'll have the most current numbers. We've been providing that information to the public, but pretty much it's been unemployment information and just trying to understand what's happening. And again, people are in different levels of this crisis right now. There are those that might be, homebound, and they can't get out to get their groceries. I know that first thing I'd like to say to anybody that knows anybody that is home and you can't help them or they can't get help, they can pick up the phone and call 211. They could call any of us. They could call the mayor's office in Fall River, if it's Fall River, or the town hall in Freetown. If it's Freetown, any elected official will connect them to the services. I know that food bank food is plentiful. It's just coordinating now where the distributions need to go under these circumstances. Many of the food pantries are still open, the CFC pantry, different ones, but definitely feel if you cannot access this, please call any one of us, Keith. So there's a lot of anxiety too, going on. People are unsure. We all are. The experts are showing us what the curve will look like. We're hearing a lot of information about things getting worse, and that is expected. We've had calls, just to give you a little more. We've had conference calls, every day and all week. We've been on conference calls, the whole legislature, the whole House, with the Speaker. We've been on with the COVID Command Center Commander, Commissioner Sutters. After I hang up from you, we're going to get on a call with Senator Warren and Markey about the CARES Act that was passed, that is going to provide a lot of resources for individuals, families, businesses, hospitals. It's a very, obviously, $2 trillion bill. So they're going to be explaining any more details we might need to know to share with our constituents. I think another big question, very important question people are asking is, I'm a 1099 employee, or I'm a self-employed, I'm a contract employee, and I don't fit under the normal unemployment insurance. The CARES Act that was passed by the federal government is made provision for that. The only concern is right now, today, at this moment, they can't go in and apply yet because the structure is being put in place. We have an unemployment insurance application structure for those who are out of work from employers, but this one is being put in place. And as soon as we have it, it will be announced, and it'll be out there.
Yeah, that was a question that a commenter just asked about independent contractors, and you just filled that in. It's going to happen. It just people have to be patient until the regulations are in place and the processes are in place, I guess, in order to do this. Correct?
Yes, Keith. So yeah, I guess I jumped ahead for that question, but it's going to be there. And I know you don't see it now. I know that doesn't help you today in terms of anxiety, but the CARES Act, in that $2 trillion package, I don't have the exact amount for that, but, and they're not all sure, right? Because it's a different structure. We know through W-2s and all that, but it's going to be in place. We're hoping very soon. And if I get an update today from Senators Warren and Markey, when they give it to us in the state, they've got to provide that structure to us here in the state, and then we'll be putting it out and making it available. So rest assured. The other thing that I think is important for the viewers to know is that extra unemployment insurance, but for those who, are making above that, and that gap is much wider, there's a $600 a week for 4 months, $600 extra funds. So that's all outlined. And I invite people to just Google if they want for themselves to see the CARES Act, Federal CARES Act passed 2 days ago. There's going to be the checks that come to those as well, the $1,200 and then the $500 per child. So we're trying to fill those gaps, Keith. So, the government, the federal government, the state and local, fill all the gaps to help people as best as possible under these terrible situation.
With all that said, the regular business of the legislature has sort of come to a halt. Has there been any discussions with the speaker and the other legislators about whether there's going to be any attempts as we move forward? And it looks like we're going to be moving forward in the way we have for at least another month, with the governor's announcement of people and non-essential businesses pretty much closed through May 4th. Has there been any discussion in terms of the legislature conducting any of its normal business, either virtually or otherwise?
So we are conducting business in informal session, Keith. So that means every 72 hours per the Constitution, per statute, we are in session. And as I mentioned at the beginning, there's only a small handful of legislators that are allowed in the building, and they're conducting the sessions every couple of days. We've already passed in informal session. I've had a poll on it, a bill that should be signed any minute by the governor, regarding some language for municipalities, some allowing them to go to a 1/12 budget, some of the towns, allowing retirees to go back and go above their wage cap because they're retired. The number of, the beer and wine restaurants, to-go restaurants being allowed to sell certain quantities under certain terms, beer and wine. So we're putting those things through. And the thing about the legislation we're passing now and will continue to pass right in the near future is that we have consensus because we know there's an emergency. We're not bickering over things. We're all weighing in, and it's passing in informal session, because informal session, a bill can stop if one person votes against it. We saw that in Washington. But we had a conference call yesterday with the speaker, and there's a small group working with trying to figure out, do we go in shifts to vote? Can we go in? There's 160 of us. So Senate has 40 members. There's 160 of us, and we sit very close to one another. So we're trying to figure out, when we have a more controversial bill before us, what we'll do, and that will be worked out. We're going to be having we had a big group meeting, conference call with the speaker. Next week, we have small working groups with the speaker. And so everything we're hearing from our constituents, all of them, we're weighing in and processing to figure out what do we need to do to make things a little bit better.
Yeah. Getting back to the question in terms of benefits and unemployment, I'm going to put in a question here from Jade, who is asking about, what about disability? And she says that most disability recipients don't file. Do we have any updates on that at all?
Well, people who are receiving disability benefits, Jade, things won't change for you. You will not be affected. Certainly you are affected by perhaps your ability to go grocery shopping, depending on the disability, or other things. People, those benefits won't change. So you should not see a financial loss. Those who are on disability, I will say, there was a provision made, an order made last week. Again, it's all on the mass.gov website. People who have PCAs, personal care attendants, there's a structure in place to ensure that people are still able, because people are afraid, right? People are nervous. People who are PCAs and others, they are entrusted with helping our vulnerable population, going into their homes, and some people don't want them in the homes, and some people don't want to go into the homes. They're nervous without proper, maybe mask or gloves. But there's a provision made or a pool of people being provided and screened, et cetera, for that. So Jade, if you have a very specific question related to you and I haven't answered it, please go on Facebook and private message me, and I'm glad to get back to you or have you talk to directly to your state representative if it's not me.
So, moving forward, Representative, it looks like, as we said, that it's going to be a good month, I guess, until maybe things get to normal, and we don't know how that's going to change. How do you see your role in terms of informing the public? I know that you send out e-blast. I get the e-blast from your office about what the information you're sharing. What types of things are you going to continue to do just as people try to live their lives as best they can?
So as a legislator, obviously we pass bills, we pass a budget, and we help our constituents. And I kind of put it in three piles like that. Constituent service will continue. And that's probably going to be continue to take up a large piece of what we do. Not everybody knows how to navigate, not only in the time of crisis, but every day. There's the registry of motor vehicle issues. There's Social Security benefits. There's just a myriad of issues that people are reaching out to us on, and we'll continue to do that. I put out, and Keith, our email is carole.fiola@mahouse.gov. Search me on Facebook. We have an e-newsletter. If you go to carolefiola.com, you can sign up for that e-newsletter. Right now, I'm sending the newsletter out twice a week, but email, online, social media, all day with updates that we receive. So I'm going to continue to inform my constituents and the public with everything I learned that's new. This morning, as a matter of fact, there's a new system for those who might think they have COVID-19. If they're not sure, we don't want you to run to the emergency room. Of course, we've been saying call your primary care doctor, but you can have this telehealth program, a BOUY system, BOUY system, and it's on my Facebook right now. And there's a series of questions, and they will guide you through to what they'd like to see you do. So I see our role as that. Next, though, very, very important, we have our budget for the Commonwealth, which provides resources to so many agencies and our communities and to our schools. We start the budget season off. We started it off in December. Here we are, April 1st. We started it in December, Keith, with what's called the consensus revenue hearing. And those of us on Ways and Means Committee sit before a group of local, regional, statewide, and national economists, experts. They come from different perspectives, but they sit before us and tell us what they see ahead for revenues for the Commonwealth. We did that in December, but a lot has happened since then. We are in the House. The governor had put out his first budget in January by statute. We then, as a House, in April, put out ours. Well, our timing is going to be off. We do our budget in April in the House, then hand it over to the Senate. Senate has the luxury of seeing the governor's budget, our budget, and then they finalize their budget. And then we get together in a conference committee and hammer out any of the differences. We know our revenues are going to be substantially different. Next week, April 7th, we have a consensus revenue hearing, a second one. We're going to kind of stop from that point and hear what the economists are saying based on what they're seeing. Obviously, we've put off some tax deadlines. We don't have some of the same revenues coming in. And so we're going to see some substantial changes. And we're going to be learning what they say to us, and that will guide us. Will we have a budget? We are typically, by statute, the second year of the legislative session, July 31st, is our deadline to conclude the business of the two-year session. We come back to the district, we work on constituent services, we prepare for the next budget season. But we had talks yesterday that we may very well extend, of course, beyond July 31st. Everything's on the table. but we've got to take it sort of a step at a time. And April 7th, we'll begin that whole revenue process again for the next year's budget. So those are two of the things. And bills along the way. We have some major bills. We have transportation bills. We have other healthcare bills we've been planning. So many things that are a little bit on the back burner, obviously because of this crisis that we're facing.
Yeah. Obviously, it's a new normal, I guess, for all of us, and it's good to hear that the state legislature is still doing its work. State Representative Carole Fiola, I appreciate your time. Thank you for joining us. We'll talk again soon. I really appreciate it.
Keith, I hope you can put up my contact information. Anybody wants to reach me. Let me just ask everyone, please stay safe, keep your family safe, reach out, and thank you for all you've been doing. It's so appreciated. We'll get through this.
All right, Representative Fiola, thank you very much. We'll talk again soon. And those of you watching, we want to hear from you about who maybe we should be talking to on these Facebook Lives and some of our other programs at FRCmedia. Send us a message either via email at info@frmedia.org, or you can send us through our Facebook page. I also want to remind you, please, to continue to visit our website. We have up-to-date information there at frmedia.org. You can find out information. You can watch some of our programs online under our programs page. And also, I want to tip you off to a special page we have around coronavirus. It's frmedia.org/coronavirus. We have updated information in terms of the latest numbers, both federally and in the state and here in the city of Fall River. We also have some links to some articles that we either have proposed on our website, or some news pieces that some of our colleagues in the news media have also produced for information for you, the citizens of Fall River. So I appreciate your time today. Thank you for joining us. We'll see you again soon, and please be safe.